What's up, beautiful people? We have another patient journeys going on. This is a series where I talk about things that I have discussed with patients or encounter frequently, or things that people will just tell me, right? Because I'm a physician, people just tend to tell you stuff without you asking. I think healthy is one of the most misused terms in the English language currently. I'll give you an example. I was sitting next to a guy on a plane and he found out that I was a doctor and we're just talking about that. And he goes, "Well, you know what? I'm in my 50s. Despite having hypertension and diabetes and being overweight, I'm pretty healthy." And I just kind of paused and looked at him and said, "Well, are those conditions, diabetes and hypertension and being overweight, associated with good health or poor health?" And then he kind of paused and said, "Well, poor health." And I said, "Okay, well, what are you basing your assessment on? What objective and subjective data are you basing the assessment that you're healthy on?" And he paused again and said, "Well, I feel pretty good." And then I said, "If I really drilled down and asked you about how you feel, like, how are you sleeping? Do you feel energetic when you wake up? Do you feel like your health allows you to do the things that you love to do? Or do you feel like you've had to stop doing stuff that you like to do because of your health? Do you have days where your health prevents you from going to work or going to a ball game or whatever?" And he paused again and said, "Yeah, there are some days where my health prevents me from doing what I want to do." And then I said, "Well, if you had to reassess, would you say that you are healthy, or would you say there are things that you need to work on to improve your health, to improve your functional capabilities, to allow you to do the things that you want to do?" And it was like a watershed moment for this person. Usually when someone says they're healthy, the first thing I say is, "What subjective and objective data are you basing this on?" And people look stunned. Because for most people, when they say that they're healthy, it's how they feel. Do they feel okay? And I would argue what I've seen in my experience of taking care of patients is there's a lot of delusion there. Unfortunately, people lie to themselves and they say that they're healthy. They feel okay. Well, there's nothing wrong with me then. I'm doing okay. I don't need to change anything. I feel fine, so everything's fine. If something was really, really wrong, I would feel really bad or I would just know. Well, if you're not being honest with yourself, if you're not being realistic about what's going on in your daily activities, what are you able to do? What did you have to stop doing? Are there days where your health impedes you from living the life you want to live? If you're not asking yourself these questions, then you're going to delude yourself into saying that you're healthy. And then using how we feel can lie to us. We know that feelings and emotions can betray us all the time, right? As adults, we see that all the time. So, yes, how you feel is part of it, but I want to know how you feel as far as, do you feel energetic? Do you feel like stress is high? And if stress is high, how do you feel like you're coping with it? Are you coping with it in productive ways or unproductive ways? Is your health allowing you to do the things that you love to do? Like, I can't remember a day outside of getting a illness like flu or COVID or something like that, where I couldn't do something because of my health. So outside of an acute viral illness, there hasn't been a day recently in the last few years, by what I mean recently, that I couldn't do something because of my health. So that's part of being healthy. It's how you feel, but are you limited because of how you feel? And is that limitation a feeling because of your health? So, really diving into how people feel, asking these questions, seeing if they're betraying themselves by not being completely honest with themselves. And we see this all the time. In fact, the ability for humans to delude themselves is phenomenal. I've seen people with tumors the size of baseballs or soccer balls, even, come in, and it's metastatic cancer, and they first noticed the problem months, sometimes even years prior, and they just thought it would go away. They deluded themselves into thinking, "Oh, this is normal, it's fine, it's not a big deal," because they're so afraid of the truth and sharing the truth with themselves. And unfortunately, I've seen people pass away from cancer that was first recognized by that person early enough that they could have been saved. So are you being honest with yourself? Are you being real with yourself? Are you taking a really good health inventory? So how you feel is important. That's one metric of are you healthy or not. The second is more objective, right? What laboratory markers do you have that say that you're healthy? So looking at blood work and not just saying, oh, the blood work's in the normal range, everything looks fine. We know, and I've spent the last 4 weeks putting together a really extensive spreadsheet about breakpoints. Well, if a value is this, what does that increase risk for? If a value is this, that means it's no risk. And then what can we do about it? It's something that I'm going to share with my patients so that I don't have to spend as much time going over lab work with them and what it means. They can clearly see the breakpoints on that spreadsheet. It also has actionable material, like what can they do about those values? That's super important because I've seen it time and time again where when I worked in the hospital, people had heart attacks, people had strokes, and they're like, well, I felt fine. And, I would ask them, did you really feel fine? Right? Trying to get them to open up about that. And then you would look at their biomarkers and you could see red flags all over their biomarkers. And you'd ask them, hey, does anybody mention to you before? Oh, yeah, my PCP said I was pre-diabetic, but they didn't do anything about it. Or, yeah, they said my cholesterol was a little bit high, but they didn't do anything about it. Or they had high inflammation markers and then nothing was done about it, right? So if you know where to look in these people, I would see signs, big red warning signs that something bad could happen. The other problem is a lot of these things have a long lead time. So from the first moment that something goes wrong, the body compensates, and then the body's able to compensate till it gets to a point where it just can't. So it can take 10, 15, 20, 30 years for some of these chronic diseases to develop. And so if you don't know where to look, if you don't know the right laboratory markers, then you can miss these things and you can think everything's fine when really there's a boiling lava underneath the surface that's going to explode at some point in time if we don't correct it. The other part of metrics is biometrics, really looking at data that we can measure in somebody that's not laboratory work. So things like grip strength. Grip strength is a very, very important marker for longevity, something you can easily measure. I ship a dyno out to patients so we can keep an eye on their grip strength and track it. And there's a break point for when things are too low. And then in which case, hey, we might need to institute more strength training or start strength training, or this is a really good indication to do strength training. Things like looking at body composition, whether that's a DEXA scan or using an index like BRI, which is something I actually track, and we can do that just using waist circumference and weight and height. So really simple thing that we can measure, we can track, we can keep an eye on that. And when it gets above a certain level, hey, we're at risk for certain stuff. We really need to work on our body composition. How many steps are you getting per day? What's your exercise level per week, right? So these are all things that we can track and we can look at. And if we're below certain breakpoints, we're at a higher risk, even though we quote unquote may feel fine. And then of course I argue, do you really feel fine? And then the last thing, the third part of how do you know you're actually healthy? One, we talked about how you feel is important, but you have to be honest with yourself. Number two, laboratory and biometric markers. Are you tracking the right markers and is someone interpreting them correctly? And then the third thing is, what do you do? This is so important. If someone says they're healthy and they don't strength train, you're not healthy, period. It's a big time risk factor for adverse health outcomes for mental health, physical health, Alzheimer's, diabetes, heart disease, cancer, you name it, if you're not engaging in regular aerobic and strength training exercise. So if you tell me you're healthy and you don't exercise, I would argue that you're not healthy because you're at a higher risk. You're putting yourself at risk. Healthy to me is about mitigating as much risk as you possibly can. There's going to be some genetic risk, right? But if we're able to use medications or supplements or peptides or lifestyle to mitigate that risk as low as possible, then I can say that you're healthy because you're doing the best that you can with your circumstances that you cannot change. But how are you controlling the stuff that you can change? So what is your lifestyle? How much sleep are you getting? Are you getting restorative sleep? Your stress levels, are you avoiding stress that you can avoid? And then what are you doing for stress management? I break stress management down into two things. There is, what do you do when you're actively stressed? So how do we lower stress in the moment? And then how do we make ourselves more resilient to stress? And if you want to know more about these techniques, there's a ebook that I have. It's completely free. You can check that out in my link tree. I'll post a link to the link tree in all of these videos wherever you're watching this from. Then your exercise routine. Are you meeting the minimum amount of exercise required for health benefits? 150 hours a week of moderate intensity. That's like things, brisk walk, gardening, light jogging, cycling. Then, or 150 minutes of vigorous exercise a week. So this is things like playing sports, working out. A lot of people argue that it's best to do a combination of both. So for instance, I like to walk the dog. We walk briskly. I try to shoot for 8,000 steps a day, but I'm also making sure that I get 4 days of strength training a week and then 2 days of HIIT cardio, because I don't like cardio. I hear it all the time. Well, I don't like to work out. I'm like, you're not a toddler. You don't just get to do what you like to do. There are certain things that you have to do. And to achieve your goals, you're not always going to be able to do stuff that you like to do, right? I don't like cardio. There's nothing about cardio I find enjoyable unless I'm playing sports, but I do cardio because it's in line with my long-term and short-term goals. What are you eating? How much are you eating? Right? What is your nutrition pattern? Are you getting the right amount of calories, the right amount of nutrients for your body, for your age, for your activity level, for your goals? All of that is important. So, in order for me to truly say that someone is healthy, I need to know how they feel. I need to know laboratory and biomarkers. And I need to know, what are you doing on a daily basis that's adding to or subtracting from your health? Right. So that is how I evaluate healthy. I think that's how we should all evaluate healthy. I think we do a poor job. And I think a lot of us are not honest with ourselves about our health. And that leads to adverse health outcomes. So hope you enjoyed this patient journeys. We'll be back with another one sometime this week. Y'all have a blessed day.